Good evening, Mr. Manish, and thank you so much for joining this session today. I'm sure that all of us are looking forward to hearing you at the conference and also understanding from your experiences, where the world is moving towards as far as healthcare is concerned, and what we could do more as envisioned by you and lot others in the similar space. First thing, just a very quick one, because we are talking a lot about technology, what's the most surprising or unexpected way technology has actually influenced your own daily life?
It's actually quite simple. I think the level of, at least on the personal front, the level of home automation is quite surprising now. Between cameras, climate, um, physical security, cleaning, really just about anything. We saw a lot of this envisioned 50 years ago and in the World Expo kind of settings, but now you can pretty much automate and run things from halfway around the world, and I have. And so I'll give you an anecdote. I'm a bit of a gardener, and I
Yeah.
put a camera above my garden so I can see how the plants are doing while I'm traveling across the world if they need to get more watered or less watered. So um, it's fascinating. So yeah.
I think you picked up a very interesting example, actually. I loved your example of home automation, definitely, which we may not even have kind of thought about it much. But your garden example was amazing. So thank you so much for sharing that. If I have to, in the similar space, one more question on that front. What's that one tech tool or a gadget you wish existed that could probably have made healthcare more efficient than what are we today?
So I think the one gadget or tool would probably be so if you think about how healthcare is delivered, there's a lot of decision making that happens rapidly. It's iterative. Diagnosis is never linear, um, at least as I've observed. And when you observe it that way, what happens is you have a lot of inputs that happen over time. And really good diagnosis of a particular condition happens when multiple specialties confer, especially for those complex things. But they all require lots of input. Today, a lot of that input is still coming in manually, right? So if you imagine a patient sitting bedside, things are not all connected into a central repository or data store. So I think the simplest gadget to answer your question would be a means to be able to take all these offline data capture devices and bring them all into a central repository so that we can leverage the best of computation techniques to help decision making.
I think nobody would have or could have actually answered this envisioning thing better than you for sure. I think definitely you are the best fit for, kind of because you come largely from a tech background. I think you have been doing a lot of work in
Yeah.
technology. So thank you so much for that. Coming to my main questions, few of my main questions first. So,
Yeah.
as I see that you have a very diverse background in terms of finance, investing, product development, and obviously a lot of technology added as a layer on all these things. Uh, how have all, these kind of experiences largely influenced your approach to leading healthcare transformation at Mayo Clinic platform?
It's funny. It's a great question. So in many ways, used to say that everything I have done before this role, allowed me to do this role. I think if I was missing any one piece, so give you an example. So I'm classically trained, as you called out, as an engineer. So I spent 9 years building a public semiconductor company, Broadcom Corporation. Then I spent 7 years doing investing in early stage companies as a venture capitalist. We're really focused on health tech and diagnostics. As an aside, at that time, there were only two pure play health tech investors in all of the United States doing venture. So said another way, there were two venture capitalists who were dedicated to health technologies in 2011 when I jumped into that. So obviously the world's come a long way. And then I went back into an operating role where, I grew from mergers and acquisitions to post-merger integration to running a platform business to, acting as a surrogate for a COO role. And so if you piece all that together in an org chart, you have governance, so been a board member, engineering, product, P&L responsibility, operational responsibility. So when they asked me to jump in and help design the strategy for platform, I'd had 15 years of healthcare experience, but all of those functional experiences that allowed me to think in a different way. And I will just say one more thing. Even though I work for a large academic medical center, my brain always operates in a capitally constrained mode, which means which means capital is scarce. There's always somebody better capitalized than you. There's always somebody smarter than you and has better resources. So when you approach the world that way, it allows you to operate at light speed with little resources, and you attract those kinds of people around you.
Thank you for that. I think, as I said earlier, a very unique combination of finance, technology, operations that you have. So, so as this chief operating officer at Mayo Clinic platform, how do you kind of envision the role of technology and data analytics in transforming patient care worldwide?
So the way I would answer this is, first of all, in the mature state, technology should disappear, meaning it should not be the end goal, the thing that you think about. It should just happen as you're doing sort of normal things. And you can point to this sort of happening in every part of your life. New technologies integrated into cars all the time. You don't actively notice it, you just drive. So that's the analogy I would use. And I think we're at this moment where actually those things are going to happen, right? So if you've ever experienced tools that do ambient listening and scribing, those are just happening. And when that happens, it allows clinicians, physicians, nurses, administrators, technicians, everybody to do what they're tasked to do, what they're good at, what they've been trained at, what they're passionate about, and not focus on the piece of technology, right? That's been the rub of EHRs, is that it forces you to operate differently. So I think we're at this cusp of actually the technology folding in to the workflow. So I think as things progress, having the opportunity for these to actually create efficiency, create better quality. So the thing we think about, and to answer your question, if you think about healthcare quality, there's so much smarts in the world that no matter what geography you're in, if you can afford it, you can get to the best quality of care, right? So, but not all quality is the same. So my former CEO used to say there's really good healthcare in the United States. It's just unevenly distributed. So what our goal and platform is to find like-minded partners who want to improve care quality through things like knowledge sharing, through data sharing, through collaborations on research, so that we can all improve our care quality, right? So at Mayo, we see 140 different patients from 140 different countries, but they're small numbers, right, from these countries. Most of our patients are from the United States. Apollo likewise probably sees a lot of patients from India, but maybe a small number of patients from across other countries. If we think about collaborations across institutions like this, we can create things like algorithms and large language models and generative tools or clinical trials that now cover two very distinct patient populations, right? And now if you extrapolate that to the globe, we are at a unique point in time where we actually can create some really interesting collaboration, so that when you're doing that novel research or discovering that drug, you can see if it's going to work for the globe or just a narrow patient population.
Yeah, definitely. Yes, we also see a lot of patients internationally, and I think what you were, when you were speaking about it, I was kind of visioning on how does all these things connect, and how it can change the course of healthcare and kind of benefit patients ultimately. So thank you for that. My next question is a little similar to what we just discussed, probably, is on how does this platform ensures that rapid technological advancements remained aligned with, the core values of patient-centric city or patient-centric care?
Yeah. So for your listeners, Mayo is a 160-year-old organization. It was founded on the bedrock principle of the needs of the patient come first. It's more eloquently written from our founding physicians, the Mayo brothers, but
Yep.
that's the summation. And if you walk around the halls and you talk to anyone, whether it be the person emptying the garbage bins, the nurse taking a blood sample, to the physician doing the most complex of surgery, that is what they're going to embody. Most of the people that work in this institution could do financially better if we went out. But the reason they're here is that they believe in the mission. They believe in this model of care. And the model of care is integrated medicine, right? So a couple of other things. Mayo physicians, nurses, administrators, everyone is salaried. No bonuses. There's no stock options. We're a not-for-profit. And so it levels the playing field from a behavior standpoint. With our bedrock principle of the needs of the patient come first, we don't move from that core value. So then when we think about partnerships, new business opportunities, and we think about decisions that are, in the gray area, we always go back to, is this going to help the patient or is this going to help patients? If we can convince ourselves that is the case, then we'll move forward. If not, then we'll walk away or not do that particular relationship.
Yep. I think I completely agree with what you said. Whenever we do something, ultimately you see that whether it's benefiting the patients or not, whether you manufacture a product or you are creating a new process or you are, kind of working on a new technology, as to how is it actually going to impact patient care and make their lives easier and better, and also largely improve outcomes. So I think perfectly fitted it, what you said. Now, if we have to go towards a little bit on the futuristic side and say that, okay, when we look ahead, what are the emerging trends or technologies that you believe will have most significant impact on these the healthcare platforms or patient outcomes improvement at large?
So I'm trying to think of the future state. I think we're entering a world where precision robotics, being able to train. So if you think about how and why the diagnosis space has moved forward on leveraging technology, right? So whether it be radiology first and then cardiology, so there's a treasure trove of data that's been captured. Now we're solving the problem for broader clinical uses because we're bringing in structured and unstructured data and other kinds of imaging data like pathology. And soon you're going to have genomics. Right. So challenge with surgery and, well, the surgery specifically is that there hasn't been a lot of data to train on. And I think we're starting to see the world of data capture for surgeries that will allow us to do some pretty interesting things on automation and robot assisted surgeries. So if you can imagine a not too distant future where a physician could do one or more surgeries at the same time or do true remote surgeries, we're not that far away. Those things are still highlighted in the magazines as marvels, but I would conjecture that in 3 to 5 years, we're going to start to see that start to take off more earnestly, especially in remote parts of the world where you don't have the same field force that you do in more centralized cities.
Really appreciate your time. Thank you so much for your time this evening. Look forward to meeting you in person in Delhi on 21st and 22nd of February. I'm sure all of us are excited to be there and to have you there. Thank
Yeah,
you.
I'm genuinely looking forward to it as well. Thanks, Gaurav.
Thanks. Good day. Bye.